Well, this Wednesday marks World Cancer Day, and this year's theme is focused on exploring new ways of making a difference in reducing the global impact of the disease. So, something that's helping doctors detect more cases of breast cancer is artificial intelligence, as shown in a world-first trial. Swedish researchers say the findings could pave the way for wider AI use to ease pressure on radiologists, but they stress it's about support, not replacement. Charlotte Lamb has more.
This mammogram takes just seconds to analyse. Abnormalities flagged instantly, not by a doctor, but by artificial intelligence.
AI can sometimes detect anomalies we haven't seen, because they can be subtle, or it can help us spot additional things, or it can also reassure us.
Long before ChatGPT burst onto the global stage in 2022, scientists were already testing AI's ability to read medical scans. A study published last week in The Lancet marked a major milestone, the first completed randomised controlled trial involving more than 100,000 women in Sweden. The results showed that AI helped detect more clinically significant cancers at an earlier stage. Still, doctors want to draw a clear line. AI is a tool, not a replacement.
I've been working in this field for 8 years, and I can tell you that AI isn't going to replace us. We're all still here, and we've still got far too much work to do. What it will do, though, is help us to be much more precise, more consistent, and more thorough.
France's National Federation of Radiologists agrees, saying an AI diagnosis must always be confirmed and corrected by trained specialists. And while the technology is set to play a growing role in medicine, its rollout will be tightly controlled. The EU's Artificial Intelligence Act, the first ever legal framework on AI, imposes strict rules on radiology to protect patients' privacy, as well as their safety.
Well, to talk more about the fight against cancer, I'm joined by Dr. Pinar Uysal Onganer, leader of Cancer Mechanisms and Biomakers Research Group at the University of Westminster. Thank you very much for speaking to us on France 24.
Hello, thank you.
I want to start by asking you about the main challenges that cancer research is facing right now. Are we looking at problems with funding, red tape, or anything else?
I'd like to say all of the above. So the cancer is extremely complicated disease, as you were saying. And according to the Cancer Research UK Institute statistics, 1 in 2 people will be diagnosed with cancer at some point of their lives. So despite the enormous progress, we still do face several challenges. The major one is the funding and the resources, as you were saying, because they are still limited when you compare to the complexity and the scale of the disease. We also need to consider the access to the early screening and also the advanced treatments. There are still discrepancy in between the different communities. So these are the main challenges. Scientifically, we also need to come up with better clinical models to be able to understand these tumors, these cancer cells, how they behave, and also how can we treat them better. So we know that all those tests we do use animal models, but we do need to find better models that reflects humans in the lab before moving on to the different trials.
You mentioned the importance of early screening, but presumably it's not the same or as accessible in different parts of the world, and therefore you don't have the same access to data. Is that correct?
You're absolutely right. Not even in different parts of the world, but even if we are thinking in the country specific. So for instance, in the UK, we do have a very successful breast cancer screening, as you were also talking about the previous news with the AI, which is brilliant, but we still have lots of problem with the prostate cancer. Because we know that prostate cancer is more common with the men that they are coming from the African descendant, but they do not go for the screening. So we do need to make more effort to educate and to make people more aware of these issues to start with. So therefore, this needs to be a very collaborative effort.
And what then do you make of the role of artificial intelligence in this early diagnosis? Is this a technology that we can realistically use a lot more in a more widespread basis?
I think the technology is there and the knowledge is like building up as well. So I am ever optimistic about these. So the AI is a brilliant tool, but like as you were reporting earlier on, it cannot replace the human being. So we can use the AI, we can train the AI to make the screening quicker and better. And this is not only about the radiology, but also we can use the AI screening for the pathology labs. So that will give us enormous power, but we still need to go back and check these things. And someone also still needs to control what the AI is reporting.
Well, apart from AI and that side of the technology, have we seen any other advances in other technologies for detection or even in terms of advances in drugs for treatment?
So AI has been used a lot recently, especially for the drug discoveries. But I personally think that we do not need the new drugs. We just need to be collective. We need to be a collective approach. So we should just like think of prevention as well as the treatment, because the prevention also brings a huge power to us. The platforms like this. Thank you, by the way, for allowing us to discuss these challenges in your to giving us a platform. So we can just discuss all of those things together, and then this has to be a collective effort between the clinicians, between the scientists, between the policymakers, pharma companies, industry, and the patients and the patient families as well. So we should all tackle these together. So AI, absolutely, it is a wonderful news. But also, we do know how to screen the tumors as well. So we can just like, instead of like treating the organs, we should just consider looking as a whole picture, if I may say, because we all are very unique. Our genetic makeup is unique. So therefore, we do have the technology, we do have the knowledge, but we do need to work together. So we do need to share the data responsibly, and we do need to educate, make awareness, and talk to each other more.
And you mentioned prevention there. The World Health Organization says up to 4 in 10 cancer cases worldwide could be prevented. So this means that they're caused by things like alcohol, tobacco, but also infections like human papillomavirus for cervical cancer. Does this mean that to combat this, it's simply a matter of raising awareness or, in the case of HPV, upping vaccination campaigns?
Think all of them together, because it's a great example you've just given about the HPV vaccine. So the major cause for the cervical cancer is human papillomavirus. So because of this like very wonderful program with the vaccinations, we already started to see that the HPV vaccine is working really well. So the cervical cancer cases are like really low. So with that, lung cancer is on the rise in women, but overall, there is a huge campaign for stop smoking, because we know that especially for the small cell lung cancer, smoking is the main cause. So that's another prevention mechanism. Obviously, the obesity is also on the rise. So this is not good for any of the health issues, but definitely for cancer. So we should be aware of these things as well. The sun screening is important for melanoma. So therefore, the skin cancers, that's a prevention. Colon cancer, we can still prevent unless we do have the family history for certain mutations that we carry. So we should be able to see our GPs. We should be able to go to the colonoscopy to be able to screen and prevent as early as possible. So there are prevention programs. The certain governments in the certain parts of the world they are using, which are working really well. There are screening programs such as we talked about. Breast cancer screening program works really well. However, they are not enough because, as we said, cancer is extremely complicated disease. We do need more of those, and we also have to make sure that we talk to the public, and the public awareness is part of our efforts.
Indeed, Dr. Pinar Uysal Onganer from the University of Westminster. Thank you very much for your time.